Hi, Jim Jamison here with Youngstown Orthopedics to talk to you today about topics in joint replacement surgery. Today we're going to talk about infections in joint replacements. Infections after joint replacement surgery can be a major problem. Fortunately, we do a lot of things to try to prevent those so that they don't happen. Those include checking patients out ahead of time to be sure they're in as good a shape as they can be medically. We check patients' nostrils for bacteria ahead of time. We also give patients antibiotics at the time of surgery and for 24 hours after surgery. Each patient gets an antibiotic wipe to clean their skin before surgery, and we be sure our operating room is as sterile an environment as it possibly can be. Other things that patients can do to prevent infections is to be sure they take care of themselves. If you get a small scrape or a cut of some kind, take care of it like you normally would. Soap and water, use a Band-Aid. But if it looks like that scrape or cut isn't healing like it should be, or is starting to get infected itself, you want to contact your medical doctor to get an antibiotic to help prevent a bigger problem. If we do suspect an infection in joint replacement, it usually presents as redness or warmth at the site of the joint. If it's a relatively soon after surgery, there might be some drainage from the incision. You might have more pain where maybe you didn't have pain before. Those are things we try to watch out for. And if we find those things going on, we can check some lab work and do some other testing to see if there is actually presence of infection. If a joint implant does become infected, it becomes a bigger surgical problem, and that's why we try to prevent them in the first place. So the take-home point is, we want to be sure you're in good a shape as you can be before surgery. Do little things you can to help keep yourself out of trouble, and the vast majority of patients get along perfectly fine. Remember, infections happen less than 1% of the time in hip and knee replacements. Thanks very much. Jim Jamison here with Youngstown Orthopedics. Look forward to speaking with you next time.